Hey everyone, and welcome back to the channel. Today, we're diving deep into a topic that affects every single one of us, but often gets overlooked: our teeth. Now, you might be thinking, teeth. I brush, I floss. What more is there to it? Well, what if I told you that the health of your mouth is a direct window into the health of your entire body? It's not just about a bright smile or avoiding cavities. Your oral health is fundamentally linked to your overall well-being and even how long you might live. So stick around, because we're about to uncover how taking care of your teeth could be one of the most important things you do for your long-term health. Let's start by thinking of your mouth as the gateway to your body. It's the first point of contact for everything you consume, but it's also a complex ecosystem teeming with bacteria. Most of these bacteria are harmless, but when things get out of balance, problems begin. Poor oral hygiene, like skipping, brushing, or flossing, allows harmful bacteria to multiply. This leads to plaque buildup, which can harden into tartar, causing gum inflammation known as gingivitis. If left untreated, gingivitis can progress to a more serious condition called periodontitis, where the gums pull away from the teeth, creating pockets that become infected. This isn't just a local issue. The inflammation and bacteria from your gums don't stay put. They can enter your bloodstream and travel throughout your entire body, triggering inflammation and contributing to a host of serious health problems. It's like having a small, chronic fire in your mouth that sends sparks of inflammation everywhere else. So, where do these sparks land? Let's talk about the heart. This connection is one of the most well-researched areas. Numerous studies have shown a strong link between periodontitis and cardiovascular disease. The chronic inflammation from gum disease can damage blood vessels, leading to atherosclerosis, which is the hardening and narrowing of the arteries. This increases your risk of heart attacks and strokes. The bacteria themselves can also travel to the heart, potentially causing infections in the heart lining, a dangerous condition called endocarditis. Think about that for a moment. The bacteria from your gums could directly impact the health of your heart. It's a sobering thought, but it highlights just how interconnected our bodies truly are. Next up is diabetes. The relationship between gum disease and diabetes is what experts call a two-way street. People with diabetes are more susceptible to infections, including gum disease, because high blood sugar levels can weaken the body's defenses. But it also works the other way. Severe gum disease can actually make it harder to control blood sugar. The chronic inflammation from periodontitis can increase insulin resistance, making the body's cells less responsive to insulin. This can cause blood sugar levels to rise, complicating diabetes management. So, if you have diabetes, managing your oral health isn't just a recommendation. It's a critical part of managing your overall condition. The connections don't stop there. Let's look at our brains. Emerging research is pointing to a surprising link between poor oral health and cognitive decline, including conditions like Alzheimer's disease. One theory is that bacteria from the mouth, specifically one called Porphyromonas gingivolas, can travel to the brain. Once there, these bacteria can trigger inflammation and contribute to the formation of amyloid plaques, which are a hallmark of Alzheimer's. While research is ongoing, the evidence is growing stronger that maintaining good oral hygiene could be a protective measure for your brain health as you age. It adds a whole new dimension to the phrase food for thought, doesn't it? And what about when we're expecting a new life? Oral health during pregnancy is incredibly important. Hormonal changes during pregnancy can make gums more sensitive and prone to inflammation, a condition sometimes called pregnancy gingivitis. If this progresses to periodontitis, the inflammation and bacteria can cross the placental barrier. Studies have linked severe gum disease in expectant mothers to an increased risk of premature birth and low birth weight babies. Taking care of your teeth and gums during pregnancy isn't just about your own health. It's about giving your baby the best possible start in life. Beyond these major conditions, poor oral health is linked to a range of other issues. It can worsen respiratory conditions like pneumonia, as bacteria from the mouth can be inhaled into the lungs. It's also associated with rheumatoid arthritis, another inflammatory autoimmune disease. The common thread through all of these is inflammation. Your mouth can be a primary source of chronic, low-grade inflammation that taxes your immune system and contributes to disease throughout your body. Essentially, a healthy mouth helps maintain a calm and balanced internal environment, while an unhealthy one keeps your body in a constant state of alert. So, what can we do about all this? The good news is that the solutions are straightforward and largely within our control. It all comes back to the basics, but with a new understanding of why they're so vital. First, the non-negotiables. Brush your teeth twice a day for 2 minutes each time with a fluoride toothpaste. This removes plaque and food debris. Second, floss daily. Flossing is crucial because it cleans the tight spaces between your teeth and under the gum line where your toothbrush couldn't reach. This is where the most dangerous bacteria love to hide. If you find flossing difficult, consider using interdental brushes or a water flosser. The goal is to clean between your teeth every single day. Your diet also plays a huge role. Sugary and starchy foods are fuel for harmful bacteria, which produce acids that attack your tooth enamel and gums. To limit sugary snacks and drinks. Instead, focus on a balanced diet rich in fruits, vegetables, lean proteins, and calcium. Crunchy fruits and vegetables, like apples and carrots, can even help clean your teeth as you eat them. And of course, drink plenty of water, which helps rinse away food particles and bacteria. Finally, and this is perhaps the most important piece of advice, see your dentist regularly for checkups and cleanings, typically every 6 months. Your dentist and dental hygienist are your partners in health. They can spot early signs of trouble, like gingivitis, long before you might notice any symptoms. Professional cleanings remove tartar buildup that you can't get rid of at home. Think of these visits as preventative maintenance for your entire body, not just your mouth. Don't wait until you're in pain. By then, the damage is often more advanced and harder to treat. To wrap things up, I hope this has given you a new perspective on your oral health. It's so much more than just having a nice smile. Your mouth is a critical part of your body's overall system. By taking simple, consistent steps to care for your teeth and gums, you're not just preventing cavities, you're actively reducing your risk for heart disease, managing diabetes more effectively, protecting your brain, and supporting a healthy pregnancy. You're investing in your long-term health and longevity. Your smile is powerful, not just for how it looks, but for what it says about your health from the inside out. Thanks so much for watching today. If you found this information helpful, please give this video a thumbs up and consider subscribing for more content on how to live a healthier life. Let me know in the comments if you have any questions or if this changed the way you think about brushing your teeth. Stay healthy, and I'll see you in the next video.